Hello and welcome to Valley Viewpoint. How are you feeling today? How is your mental health? We're going to be talking with someone that can help us out and tell us about some services that are available in the Walla Walla community. So Alayna, welcome to Valley Viewpoint. Good to have you with us. Tell us, what is Blue Mountain Health?
Blue Mountain Health Cooperative is a new nonprofit in Walla Walla. We saw a need here in Walla Walla for walk-in services. So those walk-in services are free to the public. So we serve ages 13 and up. What that is that people can present to our clinic, and anyone that's in need of any kind of services for maybe stress. I don't know if you guys have been hearing anything about extra stress from COVID or just life stressors or isolation. I know that that's something that we've been seeing a lot more of, but that and anxiety, depression, life changes, things like that, those are really appropriate things for people to present to our clinic with. The other ways to access us, I guess, would be through email and phone, which I know that I'm hoping that you guys will be able to. This is not okay.
We are going to be sharing that with our audience here at the break.
Yeah, awesome. Okay. So as long as they can have those phone numbers and emails, I think that would be a wonderful way for them to access us. People are able to do same-day appointments with us. We have 3 current clinicians, student clinicians. We have partnerships actually with Walla Walla University and WSU and Walla Walla Community College. And part of that mission and vision is to build tomorrow's workforce for mental health services today, in the face of the fact that when COVID came in, especially when COVID came in, I guess, practicum placements, which is part of training for mental health providers, went down by about 20%. There was no placements for budding clinicians to go and get clinical placements and get the skills necessary to go out into the field and really have robust skills and practice. And so that was one of the parts of our practice, was to be able to open a clinic where the student clinicians can come learn. And so we saw that need, as well as the need for direct care. And so that was part of what we were hoping to really do with our clinic, is both serve students as a learning environment and a workforce development opportunity, as well as serve this need in our community for direct care services.
So you describe this as a walk-in. So traditionally you have to call in advance or get referred, correct? Mm-hmm. And make appointments. It could be, a week or 2 or even further down the line, but here you can just come the same day.
Correct. So it's exactly as you'd think of a walk-in clinic, urgent care.
Like urgent care.
Exactly.
Okay.
It's exactly like that, but for your mental wellness. We based it off of what some of the bigger cities are doing. There's a similar one in Everett. There's one in Austin and Eugene. We looked at what those placements were doing in order to have an evidence-based approach and to say, what are some of these bigger areas doing and how can we modify that to our smaller region, so that we're not reinventing the wheel, but that we're doing something that would work for specifically the Walla Walla Valley. I think that the important part to what the need that we're filling here is that it is same-day care. Because I don't know about you, but for me, sometimes if a major life change happens and my friends are all busy or something like that's happening, I don't necessarily have an immediate resource, and that's what we're hoping to be, is an immediate resource for people that might not otherwise have a resource, or they don't already have an established counselor. And sometimes when life's falling apart, all we need is a place to go, to recenter ourselves, ground ourselves, get some of those coping skills in place. Another main thing that we do is referrals to, we connect and provide a bridge to other resources in the community. Specifically, we really want to focus on mental health resources in the community, but we will do other resources like to Helpline or to BMAC for food or whoever else, whatever the need is. But we really are trying to bridge the mental health needs. So we have behavioral health navigators, And what their specific job is, we have 5 of them right now on staff, and their specific job is to work with people on getting that bridge into longer term services for mental health if you're needing that, or to say, if you're needing legal services, how do we help you find that? Or if you're needing housing, where do we help you find that? Those are secondary. We're really wanting to focus on the mental health, but we will help you with those because we understand how those impact mental health.
Yeah, if I'm hungry, I'm worried about feeding my family, or if I'm being sued and I don't know where to turn, I mean, that can lift the level of anxiety and destroy my mental health.
Exactly. And oftentimes people are coming in with their mental health deteriorating because of all these life circumstances that are going on and saying, I don't know where to turn to, or I don't have the resources. And if we're helping fix some of those, I guess, factors in their life, mental health improves.
Well, I'm going to have to come see you with my tax filing anxiety. I'm sure you can refer me to the right people.
The Navigators will. They're great at that.
I'm just teasing about that. But I do want to ask a serious question about male and female. Mm-hmm. So you've only been at this for a few weeks. We're barely into the 2nd month. But what are you seeing in terms of the ratio of male and female persons?
You know, honestly, we were really expecting, and this is a bias. I was really expecting to see a lot of females present. The first few weeks, all we had were males.
You're kidding?
Nope.
I mean,
adult men.
I was thinking the same thing that you were, that, you know, men are tough. I mean, we don't need counseling. We're guys. And that's for women, you know, that's for the weaker sex. But you're seeing more men. I
was surprised, and we saw a lot of men that were coming in, and I would say now that we're starting to pick up in how many people we're seeing in general. I don't have the number off the top of my head, but there have been now probably maybe 50-50 men to women, which is still not necessarily what I would expect.
Yeah, me either.
But those first 2 weeks, I would say in particular, shocked me. I saw man after man after man walk through those doors, and I went, wow, something's changing.
I think that's a great sign.
I know.
I mean, the stereotypes are totally the other way, but maybe males like myself are realizing that there's no shame in seeking this kind of help when you need it.
I really hope that that is the case. I really hope that that's the case. I know that in general, just research shows that men wait longer. They wait until things get really bad. And if we can serve men's mental health earlier, outcomes will be better, that problems won't get as bad, symptoms won't get as bad. If men are willing to reach out sooner, the implications of care can be so much better. And if that's the case, it doesn't have to be, we don't have to have some of the outcomes that we are seeing as a society as a whole, especially in Walla Walla. Our rates of suicide are higher here. Our rates of deaths of despair, our rates of comorbid issues, so substance abuse and mental health combined, our rates of physical issues that are also tied in with mental health. So basically our, poor physical condition related to mental health. Those things all are tied in with our mental health, and we can see improvements across all of those spectrums if we're willing to treat mental health sooner. And so I really hope that what you just said about men being willing to reach out sooner, I think that we would see a much healthier community.
Let's talk about suicide, very sensitive issue. And you say our rates are higher than other parts of the state. So I'm wondering, does the fact that we have 3 colleges here, a lot of stress, does that contribute, or is it more, we also have a larger adult or senior population, Is that where the stress is coming in? People just don't see any more future, and I'm sick and I'm tired of it. Or what is making our area more susceptible to suicide?
You know, there's been a lot of conjecture about that. Just in general, research shows that men in their 50s have the highest rate of, I hate to call it successful suicide, but suicides that have been carried out.
Because we don't do pills, we do this.
That's exactly it.
Yeah.
And so there's little to no room for error with that. And so I think that what we have seen here in Walla Walla that I can't speak to is the fact that lately we have been seeing an increase in acuity of patients. I think that technically our rates of suicide have evened out lately. We're still higher than the state average, but that our detainment rates have been going up. I believe, if I have my numbers correct, this time that the average rate for detainment, which is mental health detainment, do you know about that? Mental health detainments. So you have to be either a harm to yourself, a harm to others, or gravely disabled. And what that means is that they believe that you're an imminent risk. Crisis believes that you're an imminent risk to yourself or to somebody else. And if that's the case, the courts will order you detained to an inpatient facility. And the rates for that are on average 3 to 4 people a month from our county. In January, 31 people were detained. So.
Is that the pandemic? What has changed?
I mean, I would say isolation is a big factor. Isolation's a big factor. That is horrible for people's mental health and all the stresses that come along with that. You have to look at all of the socioeconomic factors that have happened because of the pandemic. People's mental health has just deteriorated because of some of the stressors of this and all of the life changes that have happened because of it as well. And honestly, what I was expecting to see with our clinic when we opened it was a lot of loneliness. I was expecting to see people adjusting to pandemic and post-pandemic, now that we're kind of coming into a new normal, pandemic life, and anxiety, depression, those kind of things.
This is a really important topic, and we want to give it some more time. Mm-hmm. Right now we need to go to a break, and as soon as we get back, we're going to pick up this very, very important subject, so don't go away. We'll be right back. Hello and welcome back to Valley Viewpoint. If you are just joining us, our guest today, Alayna Brinton, is talking about our mental health. And as we left for break, we were talking about the very important topic of suicide. So let's pick up where we left off, Alayna, and what can we do about this problem? And if people are watching right now and they are thinking, you know, my brother, my wife, my kids, you know, I see signs, I'm worried about them. I mean, can they contact Blue Mountain Health and you can direct them on what to do next?
That was another interesting thing that we were seeing a lot of that I was not expecting when we opened our clinic. We saw a lot of family members calling on behalf of their family members. And yeah, we would love to be able to give resources to family members. We can't necessarily force someone to come into services with us.
Yeah.
We would love to offer services to those people. And
a lot of people don't know where to turn though.
Yes, exactly. And so we can, if for example, a parent calls for their adult child, we would be happy to give them information about who they can contact for support for themselves, and resources for how do we deal with this depression and suicidality that my adult child is maybe struggling with, so that then they can know how to support their child, and maybe some referral information for that child when their child is ready to accept help, as well as what are the crisis numbers, how do I access that? How do I access the suicide hotlines? Those kind of things. I think that those are really important information that people should know, especially with what we're seeing as it's another pandemic, frankly, the mental health pandemic. It's worldwide.
Tell me a little bit about Alayna. So how did you get involved with this? What's your training? And why are you passionate about this?
I'm a licensed clinical social worker, so I've been in the mental health field for 14 years now. I started out working on a kids psychiatric unit. I transitioned to an adult psychiatric unit, and I think that doing that work with very acute mental illness really helped give me the experience to see across the spectrum of care what it looks like to deal with people at the pit of despair. After doing that for 7 years, I ended up stepping out. I worked in geriatrics for a while at nursing homes and in outpatient clinics. And once I ventured out on my own, I wanted to start developing clinics that would help fill needs in the community. And so this is one of those projects.
How do you deal with the stress, the personal impact of working with people in crisis all the time?
I think that one of the biggest things I do for myself, I do ensure that I am taking care of my basic needs. I do a lot of meditation. I do a lot of prayer. I do a lot of my own self-care practices. I think it would be really easy to lose myself in this if I wasn't doing those things. I try to make sure that I am keeping my own social world healthy, that I'm spending time having fun with my friends, with my kids, doing those things. If I didn't have those things, I wouldn't be able to fuel the passion that I have for these projects. I just naturally feel so passionate about mental health and mental health equity too, as well, having the fact that people should have access to these services, which is why our services are free. I don't think that anyone that is in a crisis situation or that is in a place of despair should be turned away for care.
Now, is this funded independently, through state funds, it's free to the person who comes in, but obviously there needs to be financing for it.
Yeah. So right now, I do a lot of times, I apply for a lot of grants. So I try to find grants. I have so far, we got a county grant, so we're county funded. We have a couple small private funds for grants and donations. We also do have some insurance contracts, but I don't intend to do any insurance funding until we have licensed clinicians on staff. But any services that we run through our student clinic will always remain free. So
you have students that are being trained. How are they supervised to make sure that the quality of care that your clients receive is up to standard?
That's a really good question. So I am a licensed clinical social worker and an approved supervisor. So I supervise them as their task supervisor. And then we have Harmony Smith, who is an approved supervisor who also supervises them. So she does 1 hour with them every week, and then she does group supervision with them as well. And then they also have their supervisor through the university who does field supervision with them. So they have a ton of oversight. And then they also have a supervisor who helps me supervise them at Providence, where we're located. So technically they have 4 supervisors. So they're being watched.
And they may need some counseling just because everybody's watching them.
Exactly.
Right?
We have a super loving environment. We have a very loving environment that we have cultivated where they're allowed to learn, but we do have a high standard of care, So it goes both ways.
Now, where is your physical location, and how can people access the services that we've been talking about?
We're located at 1103 South 2nd Avenue, so at the Southgate campus, where Providence is now, where General Hospital used to be. So it's a little office that is right off of the main hospital. And
Okay, so you're close to urgent care there, or?
Yep, actually right across the way. So you know how urgent care is to the left? We are to the right of the building. In a little building, it says there's population health, and then we're in the same building as population health, and we have signage on the door that says Blue Mountain Health Cooperative.
And you said that the services are provided free. Are there any expectations about the clients at this point?
If they're free to donate if they want, and they're free not to if they can't or don't want to, that is, up to them.
Now, you mentioned that you're getting funding through the county, there are other sources, and you said including donations. What if one of our viewers today is saying, you know, I really see a need for this in our community. I would like to step up to the plate and provide some funding myself. How would they do that?
That would be amazing. They could reach out via email to me, and I could let them know how to move forward with that. We are a 501c3, so we're fully tax deductible. But yeah, any donations, we don't have any private donors yet since we're so new. But that is one thing that I am hoping at some point to obtain.
Now, you've just begun. Looking forward, say a year, where would you like to see Blue Mountain Health at that point?
Oh, you're going to take me down that, huh? Oh, I've got big dreams for us. I want to continue to expand our workforce development program. I think that that's going to be crucial in continuing to train up social workers that are going to be skilled and ready to serve in our community and that are going to stay in our community because of the shortage that's here. So I would like to continue to expand that program. The only way we're going to do that is to bring more licensed people on staff. And so we need to be
So is that a funding issue?
Yeah.
Okay.
Yes, that's a funding issue. Currently, I'm the only funded staff person, and it's, well, that's not true. We also have Harmony who's funded. So we have two licensed people that are funded, and we have 10 students total, and it is a lot on
now,
two licensed
at what
clinicians.
point in their training do they begin this work with you? I'm sure you're not talking with someone that is a freshman or a starter. So what do they have to do in order to qualify to be in your program, to receive the training that you're offering them?
Our navigators can start out as associate degree. So they can be doing the navigation piece, which is basically the case management as associates or bachelors.
Okay.
But to be doing the actual clinical services, they need to be in their master's program.
Okay.
They can be a master's in in social work or in psychology. So they need to be moving towards a degree that's going to get them licensure, so that they can be practicing independently in the field after their through their program.
In the program, do you have more men than women, more women than men, or about equal?
We only have 2 men in our program right now, but that is one thing too that's really important to us is to continue to try to make even our workforce development program multicultural and thinking about diversity in our program. We have a bilingual speaker, English-Spanish speaker, which she has been a huge blessing to us. She translated all of our material into Spanish. We have, like I said, 2 men, and they have helped us reach out to that demographic. And then we have people that have kind of come from all walks of life across the age and across, frankly, we have people that have come from all over the state. So it's been really helpful to have that, little pieces of kind of everywhere that have just come together in our little workplace culture. And I want to be able to continue to offer that because I think it helps us learn from each other too.
What are your hours?
Right now, our hours are 10 a.m. to 6 p.m. on Tuesdays and Wednesdays, and 9 a.m. to 4 p.m. on Thursdays. We're hoping to be able to expand to 5 days a week once we can get more of the student clinicians.
Very good. We have covered an awful lot of ground in just a short period of time, and I want to thank you. So much more needs to be said, but we wish you the best.
Thank you.
With Blue Mountain Health, and hope that people who are watching today will avail themselves of your services. And thank you for joining us on Valley Viewpoint. If you have an idea or a concept for a future program, why not contact us at Valley Viewpoint at bmt.tv. For Valley Viewpoint, I'm Dan Solis.